Hello, YouTube. This is Dr. Tahir on youthful medicine. I would like to tell you about a case that I saw earlier today, and I think there's a learning opportunity here. This patient is a about 21-year-old female and who has chronic musculoskeletal pain, including her pain in her peripheral joints, which we call like your wrist, elbow, shoulders, knees, ankles, but also a pain which is throughout her spine, which is in her neck, lower back, and pelvic joints. Patient was evaluated by physical therapy and they said, well, we can't really help you, you're not improving. They sent her back to primary care, and then the primary care sent the patient to me for evaluation. And based on the history, it seems like that the patient had constant pain since her early teens. Pain does not respond to much of to any medication. When I saw her the first time, I gave her some prednisone to see if that would help, but no help. She has tried medications like ibuprofen and other over-the-counter anti-inflammatories, which have very minimal effect. So the patient constantly has pain, very poor quality of life. And in the history, it seems like that she has a lower body mass index. So she's like, mostly, she tells me that she did not eat much of a healthy food when she was younger, and she had mostly carb diets. But now she is with her and her partner, and they seem to be working on a better nutrition. So when I saw her, I was actually struggling with diagnosis. So my differential diagnosis was ankylosing spondylitis, another autoimmune like an inflammatory disease of the spine, which is more common in males actually, ankylosing spondylitis. I also was thinking about DISH, which is like the disease where it causes accelerated sort of inflammation leading to bone growth, and scoliosis, which is another disease. So we did an x-ray and it was fine, didn't show any damage to either of her spine or SI joints. But I also checked her for inflammatory markers like cedrate, C-reactive protein. I checked her for rheumatoid factor, anti-CCP antibodies, anti-nuclear antibodies, and also ankylosing spondylitis related genetic marker HLA-B27, and other nutritional markers such as B12, folate, vitamin D deficiency. So today, after about 2 weeks of trial of prednisone, she came back and not much improvement. So I decided that at the last visit, I decided to add some additional tests, which I usually suspect if I see a young female without any actual joint swelling, but pain which is there all the time, and with some questionable history of their diet pattern. And long behold, she turned out to be positive for high levels of antibodies against what we would see in a patient with celiac disease. There's an antibody called deamidated gliadin antibodies. So these antibodies are seen in patients with who are sensitive to gluten, and they would produce this gluten exposure over time would produce these antibodies, and this is an immunologic response, might mean that they're more likely to trigger an immune response in susceptible patients when they're exposed to gliadin. So clinical significance of DGA antibodies, positive G antibody, may indicate that they have gluten-related disorder, including celiac disease or non-celiac gluten sensitivity. In patients, when you have chronic musculoskeletal test and a positive result of DGA antibody, it could suggest that you may have gluten contributing to an inflammatory process. And then I found it out with more history that actually she does have a history of malnutrition as well as indigestion, irritable bowel syndrome type symptoms of where a patient may have constipation, diarrhea, or gas or bloating. Another antibody which was very high in her was the tissue transglutaminase antibody, or tTG-IgA antibodies. These are antibodies produced in response to the tissue transglutaminase, which is an enzyme that modifies the gluten protein in the intestines. So these clinical significance of this test would be that if these markers are high, these patients are most likely suffering from celiac disease. And there is a connection between the chronic musculoskeletal and joint pains in associated with celiac disease patients and those who actually are being evaluated for an autoimmune disease. So there's an autoimmune connection. Celiac disease patients and gluten sensitivity patients can lead to development of systemic inflammation, which can present as joint pain and musculoskeletal discomfort. There can be an overlap of autoimmune disorders and celiac disease patients. So you may have a patient with rheumatoid arthritis, such as or even autoimmune disease like Crohn's disease or lupus, and they may have chronic joint and pain and may also have celiac disease. So there could be a connection where the chronic inflammation of the gut leads them to develop further autoimmune disease. Most likely, these patients should be sent to gastroenterologist for a biopsy to confirm the diagnosis, but it won't hurt to give them a dietary challenge where getting rid of the gluten may help improve their symptoms. All right, until next time, we'll see you later.